So good evening, everyone, again. I'd like to first thank the organizing committee, Dr. Mohammed Jamal, Dr. Shabak Roof, for inviting me. Initially, when they told me my talk will be about how to establish the optimal team, I thought I was lucky, because I thought it's going to be very easy. It's going to be fun. But when I started working on the presentation, I realized that unlike the other topics, where there's scientific evidence and guidelines and literature, when it comes to setting up a team and managing human resources, there isn't much. Most of it is based on experience of individual team leaders all around the world, and it turned out to be very, very difficult. So I'm going to try to summarize what I think in my humble experience. I know most of you here, a lot of you were my consultants throughout my training, and me being the youngest chief of surgery in the history of this country, I do believe I have some experience that I'd like to share with everyone. I have no disclosures. What I'm going to do is present a few snapshots of how we set up the team at Jabr Hospital, and what I specifically think were important milestones in developing the team that we created in Jabr. To start off, I'd like to give a very short story. So a lot of these are stories from my own life, and I like talking about my life a lot, so I hope I don't bore you. In 2018, I was in London, and I did my fellowship in colorectal surgery. So I have both a bariatric and a colorectal fellowship at the Royal Marsden Hospital. For those of you who don't know, the Royal Marsden is a very old, relatively old hospital. It has 77 beds, but it's considered one of the top cancer hospitals all around the world. And I was lucky enough to do my fellowship there. When I returned to Kuwait in 2019, I had the honor of being one of the first surgeons, one of the first 13 surgeons who established the department in Jabr Al-Ahmed Hospital. Now, in comparison, Jabr is a high-end 1,200 bed hospital, a total of 40 operating theaters compared to just 6 or 7 at the Royal Marsden. The latest in infrastructure, a standalone trauma center. And I decided to invite the professor who taught me colorectal surgery, Professor Paris Tekis. So I invited him over to basically show off the hospital. And I told him, listen, I'm working here. Look at this place. It's massive. There's, just to give you a perspective, there's 5,000 parking spaces just for cars. And I remember he looked at me and he said, Sulaiman, this is all very nice. This is a great hospital, great infrastructure. I congratulate you. But he said, do you remember the Marsden? And I said, yes, I remember. He said, do you remember how many beds we had? And I said, yeah. He said, we had 77 beds. And the whole department of surgery was, I think, 3 colorectal surgeons. And he said, we still managed to be the #1 cancer hospital in Europe, arguably the whole world, because there's few people from the States. I don't want to step on any of their shoes. And he said, do you know why? And I sat there wondering why. And he said, because it's not about the place, it's about the people. And until today, these words resonate in my head. As we were building Jabr Hospital, I used these as a guideline for me in constructing the team. And I think these were the most important things that led us to create the team we have today in Jabr Hospital. To make this presentation more objective, I decided to find an example in history of an event where people struggled as a group in order to achieve their goals of an ideal system. And I looked and looked and looked and decided to give the example of the French Revolution. The French Revolution, as most of you know, was a series of revolutions, a series of wars, ups and downs in the 1700s up until the establishing of the French Republic. And during the French Revolution, the people struggled, but they put 3 main goals in front of them to achieve the Republic. And it is arguably the most politically changing revolution in history, in modern day history. So the 3 main goals they had were liberty, equality, and fraternity. And this represents the 3 colors of the French flag today, the Republic of France. I'm going to use these 3 topics to tell you the three main guidelines on how to establish, in my humble opinion, the best team in any hospital all around the world. So we start off with liberty. So liberty means freedom, basically in French. When we look at this picture in an operating theater, we ask the question, who is the main player on this team? Is it the surgeon? Is it the anesthetist? Is it the assistant? Is it the anesthesia technician? In my personal opinion, the most important player is the patient. And unless you give patients freedom in choosing how you treat them, you can never achieve an optimal team. Today, we have lots of research showing shared decision-making. So basically, evidence-based medicine isn't just your experience, it isn't just research, it's also, and it's a very important aspect of the triangle of evidence-based medicine, you need to factor in patient values. You need to give patients autonomy in choosing how they get treated. I remember when I was a trainee, I worked in Amiri Hospital when they first started doing sleeve gastrectomies. This is 2008, 2009. And I still remember we used to work with a consultant or a few consultants who the patient walked in and he would just tell them, or she would tell them, you're having a sleeve, you're having a bypass. There was no discussion, there was no workup, there was no interaction with the patient values. And this, we know today by evidence, is not right. So the mnemonic share is now being used all around the world in the medical field to help treat patients in an optimal way by understanding what the patient wants in addition to what you as a healthcare professional think the optimal treatment is. In the literature, there are a few studies. This is one specifically in bariatric surgery, 2019. You can see here that when the patients were involved in the decision-making, there was a positive correlation and a significantly positive correlation with decision satisfaction. So they asked the patients afterwards if they're satisfied with their decision. And there was a negative correlation, again statistically significant, with regret. So there was less of a chance that they'd regret the procedure that they chose to undergo. A very recent publication, again, on shared decision-making. This is a very hot topic, published in Obesity Surgery this year, shows that when the patients were involved in the decision-making, more patients with diabetes decided to have a bypass instead of a sleeve, as opposed to just the surgeon choosing. And again, this we know is better outcome for diabetes resolution. How did we apply this in Jabra Hospital? When we started the bariatric program in 2019, we decided to have the patients involved in the decision-making. Again, this was very new to Kuwait. I know in places like Cleveland, you've been doing this for the past few decades. But again, for Kuwait, when you tell surgeons and when you tell patients you're involved in this decision, it's something major. We held classes for, I can't show you pictures of patients, but we held classes for every single patient undergoing bariatric surgery. Again, the educational classes were led by our team of excellent dietitians and Professor Ahmed Al-Sirri, who's somewhere here, I'm not sure where, professor of genetics. He's in the back hiding. And in this process, we involved the patients in the entire process of bariatric surgery. We even taught them how to prepare their food after surgery and made sure they understand all the different options they have before they come back to the surgeon and together with the surgeon decide what the optimal treatment is based on the patient values. And this, I think, was a very big jump in the way we treat patients and involve the patients in the team. Second aspect, I'm going to go through the first two quickly because the third one has lots of pictures and I like the pictures. Equality. Traditionally, and again, a story from my experience, when I first became a trainee, one of the consultant surgeons, I remember, and Dr. Mursi was there in Amiri Hospital. I remember we left the morning meeting one day, and he told me, Sulaiman, come with me. He dragged me by the hand, and then he showed me all of the different departments were finishing their morning meetings. So the pediatricians were coming out of their meeting, internal medicine, anesthesia, and Amiri is a very small hospital, so you can see all of them. And again, I just graduated from medicine, so I was fresh. He told me, you see all of these people? And I said, yes. I thought he was going to tell me something that's very philosophical. He said, you know, they all work for us. And I said, really? He said, yes, because the surgeons, I still remember, he said, the surgeons are the lions of the hospital. and everyone else is just there to help us out. And this is how I was raised. I hope Amir is not like that anymore. But this is how we were raised. The surgeons are the epicenter of everything, and everyone works for us. And it's not until I went abroad and worked with Dr. Evangelos in Chelsea that I realized that that's not true. Everyone is equal, and everyone is equally important to the surgeon. This is what a normal team, a healthy team should look like, where everyone votes and everyone has equal say, regardless of your specialty or background. We know this is true. There's lots of publications on MDT approaches to bariatric surgery. We know, for example, in this paper that when cases were discussed in an MDT, 17% of patients, the surgeons asked for further investigations, 30% the anesthetists asked for further investigations, and another third, the dietitians requested the patient needs further education. So we decided to apply this in Kuwait. Again, 2019, it might seem strange to the world that up until 2019 there was no bariatric MDT in this country, but it was 5 of us who initially started. I see Dr. Mohammed Al-Ajmi there. He's the Kuwait's first bariatrician. We started the bariatric MDT, just the 5 of us, planning it out. And then we slowly started growing. So again, the surgeons did not like it because you no longer have the final say. The patients did not like it initially because they wanted to go to a place where they can just have their surgery done quickly. But we knew this was the right way to go. We had that in mind. In our meeting, clinical psychologist, Dr. Maryam Bulhassan, she had an equal say to the dietitians, to us, the surgeons. So if the psychologist said the patient cannot have surgery, they cannot have surgery, and no one can override that. And again, this was major in Kuwait, but we had to show people that there was equality in the team, for the team to grow. Because if every time the psychologist said something and the surgeons overrode that decision, you would lose the sense of wanting to make a change and wanting to have a better team. So the team grew. This was back when we first started the multidisciplinary team. Dr. Muhammad Jamal is in this picture, and me as well. We didn't have all the gray hairs we have today, but we slowly grew, and in 2020, we became the first, and we remain the only government-based hospital in Kuwait with a Center of Excellence accreditation from the SRC up until today. And this was a major jump for the healthcare system in the entire country. Finally, fraternity, which translates into brotherhood. And I think this is the most important aspect when looking at establishing an optimal team. Many places around the world, there is a rivalry between surgeons. You have people attacking each other, not helping each other out for many, many different reasons. And when we established the department in Jabir, we made sure to get rid of these differences. How did we do this? So when I first joined Jabir, for those of you who work in Jabir today, this is what it looked like. It was completely empty. Today, if you go, you cannot find any parking even around the roundabout. There's cars everywhere. This is what the lobby looked like. There's not a single person. And when I joined, there were 13 surgeons in the department, and there was absolutely no work. There was nothing getting done. They had just started. The team was led by Dr. Sulaiman al-Sabah, who is coming later today. And these were the initial surgeons of Jabir al-Ahmed Hospital. He had taught us, and I give all thanks to him, to be honest. He taught us the sense of camaraderie, that we're all on the same team and we need to help each other out to grow. We cannot grow by ourselves. This was what the hospital looked like when I first started, and these pictures were taken by me. These hallways, if you go today, you cannot see the floor. It's jam-packed, busy. And it's hard to believe that this is what it looked like when we first started. We knew that we had a lot of work to do. This is my favorite picture. This is Dr. Mahmoud Rashidi with Mr. Sharif and myself. This is what the operating rooms looked like. And I don't know, for those who are working in Jabir today, these are the operating rooms that you operate in every day. And I'll show you what this operating room looks like today. Myself, Dr. Mahmoud, who has his hands raised in the back, worked together to help build the place hand in hand. These are what the operating rooms looked like when we received the hospital. So it was a naked hospital. There was nothing going on. And we knew that unless we worked together hand in hand, nothing would happen. Dr. Mahmoud Rashidi took a pickup truck, went himself to the Central Medical Store and got this equipment for us. There were no scissors, no forceps, and unfortunately, a lot of the other hospitals in Kuwait did not help us initially because they thought the hospital was doomed to fail. And I say this now with all honesty, it was a very difficult time for us. And if it wasn't for us standing together, we couldn't have achieved what we have today. This is what the morning meeting room looked like. If you go there today, there's no place to sit. There's people standing in the back, and it's become a very hot and sweaty room, actually. So this is Sharif, the head of the OR. Him and myself worked very hard, and again, there's a sense of brotherhood. It's not about being a nurse or a doctor or a surgeon. We're all equal in this, and we can all work together to help build the place. We built it slowly. This is Dr. Mahmoud Rashidi performing one of the first endoscopies in the hospital. We performed it before the gastro team, actually, and he was very happy because this was the first CLO test, actually, in the hospital. And again, we had to teach each other. So some of us had come back from fellowship training, and for example, Dr. Mahmoud at the time wasn't fellowship trained, so we didn't see each other as a threat. We didn't see each other as potential competition in the private practice. No, we genuinely wanted to help each other because we saw each other as brothers. This is another example. So this is us with the colorectal team, Dr. Ahmed Al-Khamis and Badr Sha'ban. We performed the first colorectal resection in first colon resection 2019. And I doubt that anywhere around the world you can find a group of colorectal surgeons hand in hand like this. They're usually always fighting with each other. The truth behind this picture is we were actually laughing because Ahmed Al-Khamis was the only one without a beard in the picture. We did the first bariatric surgery again, 2019. And again, Dr. Muhannad Al-Haddad, one of the consultant bariatric surgeons, helping others, teaching them, taking them step by step without an incentive, just out of brotherly love. One of the major advances I see and biggest examples of camaraderie and brotherhood is Dr. Evangelos, who's sitting here. He was actually my professor in 2016-17 when I did my bariatric fellowship. And we had asked him to help us establish the team in Jabr Hospital when we first started. Even though he had a very successful practice, he was the chief of surgery. Out of pure love and a sense of brotherhood for us, he decided to accept. And right now, he's one of the most vital members of the team in Jabr Hospital. And I know he had to sacrifice a lot. His family is still in London. But this is the sense of brotherhood that shaped the department. And he now works with us in Jabr Hospital. This is us operating in Jabr.
Sulaiman, 3 minutes.
The biggest milestone was the opening of Costa Coffee, I think, in Jabr. After this, things started booming. So we got the robot in 2020. And again, we had initially only 2 robotically trained surgeons, and we remain the only general surgical department with the Da Vinci. We've the XI arriving tomorrow, actually, in Kuwait. We hope to boom more and more. And together, of course, things started going crazy after that. We became the busiest surgical department. Today, we are the biggest surgical department in Kuwait. We have 190 surgeons. From an initial 13. We have the busiest OR lists. We run 13 OR rooms daily, and we do around 800 cases a month, which is the highest volume in all of Kuwait. We've built up from there. We've established the region's biggest hyperbaric oxygen therapy center. We now do more cases than anywhere else in the region, hyperbaric therapy. And it all comes down to this initial photo. So this room that you see with our brotherhood and with the concept of helping each other out is now, which is this room as well, has now become this room that you see today. This is the same exact room. It is an Olympus, easy 4K room, and it is arguably, I think it's the most beautiful room in the world, arguably one of the most beautiful and elegant rooms all around the world. And we use it today to do the most complex cases in the country and in the region. So finally, again, I go back to the main point. It is not about the place. It is about the people who are working in the place. And I assure everyone today that if you take the same team that we have in Jabir today, or the same team that we had in Jabir when we first started, the 13 surgeons, and you put us in this building in the middle of the desert, I promise you we will make it the best hospital in Kuwait, if not the region, because of us working there and not because of the building. Thank you very much for listening.